everybody. I'm Dr. Nick Circolone. I am so excited to be here as always. Today we're going to have a continuation of the show talking about how the neck can be associated with other symptoms. Today we're going to talk about a specific symptom called headaches. A lot of people suffer from headaches. I was one that had suffered from headaches from a car accident where I was hit by a car and flipped up in the air, landed on my head, and had a deep pressed fracture of my skull. The doctors took care of that deep pressed fracture of my skull, but over time, I did not know that my neck was involved in that due to that trauma. So one day, I ended up having to go to a chiropractor after getting hurt on a job, and lo and behold, my headaches went away. So I was like, there's something to this. So the doctor and I became friends. It's Dr. Land. He and I became friends, and he talked me into going to chiropractic college. I was in college at the time for teaching, but he talked to me into going into chiropractic college, and I did. And I've never looked back. It's 32 years, and I love treating patients and changing their lives. So before we get started, don't forget to hit that notification button, like us, subscribe to us, so you can get those videos as soon as they come out. Let's get started. So how does the neck really relate to headaches? Well, if we have any tension in our neck coming from any of the vertebrae in there, these 7 vertebrae that we talked about before, it will cause tension in the neck. It will cause tension in the occipital area. It'll cause tension in the temporal area, in the frontal area. You'll get pain in your eyes. Sometimes people get pain in their teeth because those muscles are so tight that they pull down on the internal and external pterygoids and causing pain in the teeth because the nerves that are in there are being affected and compressed by the muscles that are there. There will be some people that are watching this video going, no, that can't happen. Yes, it can. And I've seen it happen in my practice. Is it rare? No, it's not rare. It happens quite often. So that's why we have to evaluate everything. So if you're having manipulative therapy and you're still having headaches, they're missing something. If you go to the doctor, and I want to say this, I want to get this out of the way. If you go to the doctor and they're evaluating you for headaches, and you're going to either a physical therapist or a chiropractor, anybody who does manipulative therapy, and you're not getting better, you need to go for further evaluation and further testing because it could be something else. Or they're not treating you the right way. They may be only adjusting the vertebra, not working on the muscles, not doing any traction. Could be a number of things. You have to get evaluated first, and it's got to be evaluated properly. Do all people that have neck pain and headaches need x-rays? Not in the first visit. But I do recommend if you're having cervical type headaches, you want to get an x-ray. It may be get other things. You may be get an MRI so we can evaluate the soft tissue in that area. It may be get a brain MRI to evaluate the brain and make sure that there's nothing going on in the brain causing your headaches. But once we evaluate the spine, once we know it's nothing else other than a neuromusculoskeletal condition, then we can proceed to start working on it. So if you're suffering from headaches, if you're dealing with debilitating headaches like I did, manipulative therapy is an awesome option to try. I have a lot of people that come into the office and they're like, Doc, I don't care what you do, don't touch my neck. Okay, why? Well, I've been watching those videos on TikTok and I don't want to hear the sound and it looks pretty violent to me. I agree with you 100%. If you have headaches and you're dealing with this type of pain and you're afraid to go and get manipulative therapy because of what you've seen on the internet, let's pull that back. Find a doctor in your area that is non-aggressive. Talk to people. Look at their reviews. Call the office. See what kind of treatments they do to make sure that they aren't going to be too aggressive for you. Now, some people like an aggressive adjustment. I like an aggressive adjustment. I don't aggressively adjust patients because that's not what they want. So in my office, we'll use soft tissue therapy, myofascial release, soft tissue mobilization, instrumentation, and of course, manipulation. Now, our manipulation is not violent. When I have patients come in and they go, please, I don't want my neck touched, we'll do something else in order to facilitate mobility and get motion back into that joint, helping to decrease the pain, helping decrease the symptoms of the headaches. Now, headaches are just one thing, and that's what we're talking about today is just headaches. So if you're having a headache and they seem to be migraines, you've been diagnosed with migraines, if you have cluster type headaches, if you have headaches that they believe is coming from your eyes, you've gotten your eyes checked, you've gotten glasses, but you still have those headaches, chiropractic and other manipulative therapy is probably the way you want to go. And take it from me, a person that it's changed his life, I guarantee it'll change your life. Stay tuned for our next video. We're going to be talking about some other things that are associated with the cervical spine. I love you. We'll see you soon.